Hi guys, in this video we are going over the neck muscles and also a very important bone, the hyoid bone, which is the only bone that we have in our body that does not articulate with any other bone. Remember, the hyoid bone is part of the exoskeleton and it's just hanging right here. And if you put your fingers right here and you swallow, you can literally see or feel the hyoid bone moving up and down. And that just happens because the muscles are holding to it. And every time we are swallowing, we are contracting different muscles, and then the hyoid bone goes up and down. So let's look at these muscles right here. Now, here we have the hyoid bone. You see that? This is the hyoid bone. How beautiful, right there. Now, if the muscle comes and grabs the hyoid bone, it will have the hyoid in the name. Look at this. You see this? This muscle right here, it goes from the sternum, which is the chest bone, the sternum, all the way to the hyoid. Consequently, this muscle right here was named sternohyoid. Now, this muscle that you see right here, you see that it comes like a little diagonal because it comes from the shoulder all the way to the hyoid. And the shoulder in Spanish is hombro, right? So this muscle that goes from the shoulder area all the way to the hyoid is conveniently named omohyoid. This one right here. This is the omohyoid. Now, if we look at this muscle right here, you see this? This and this. Not this. This one. This guy is going from the mandible all the way to the hyoid. And the root for mandible is mylo. So this muscle right here is the mylohyoid. Now, we have another muscle, and this is a tricky one to show. Can you see that we have a muscle right here? And then this muscle right here, it's actually one belly. It's the posterior belly right here. It goes underneath this one. Can you see that? So you have this one, just follow it down. So you have this, goes underneath this one and keeps going here. This muscle right here that has two bellies, one belly here, goes underneath this, and the second belly right here is the digastric because it has two bellies. Now this one that goes from here actually goes from the styloid process of the temporal bone all the way, and you can see it is stopping on top of the hyoid. You see there? It's grabbing the hyoid right there. This muscle right here is the stylohyoid because it goes from the styloid process of the temporal bone all the way and grabs the hyoid bone. So this is the stylohyoid, and this one that goes underneath the stylohyoid and continues right here, this is the digastric. Wonderful. Now let's look at these muscles that we have on the lateral and posterior aspect. This muscle right here is the trapezius. Trapezium is a carpal bone. Trapezius is a muscle. And the trapezius is very, very big. And we can see the trapezius in its entirety in another model that I'm showing in another video. But for this model, you can see the trapezius right here. Now, these three muscles that you have right here, these are the three scalenes. And you have the anterior scalene, middle scalene, and posterior scalene. Obviously, this one has to be the anterior because this is the anterior aspect. So anterior, middle, and posterior scalene. Can you see that? Hopefully, yes. Now, this muscle right here is the easiest muscle to identify. This muscle is called sternocleidomastoid. And this muscle has two heads, one that is in the sternum, the other one that is in the clavicle, and these two heads run together towards the mastoid process of the temporal bone. So when you look right here, you see this is the sternal head of the sternocleidomastoid. Here you have the clavicular head of the sternocleidomastoid, and then these two heads, they run together and they go towards the mastoid process of the temporal bone. Now, the last muscle we are missing to look in this model is the splenius capitis. Can you see that? This triangle right here? This is the splenius capitis, this right here. This is the splenius capitis. It is covered partially by the trapezius. Now, this other muscle right here, it goes and grabs my scapula and elevates my scapula. And this is the one that we call levator scapulae. Now, the way I suggest you to remember is by remembering that you have right here, remember I told you that you have the three scalings right here? So you have the anterior scaling, middle scaling, and posterior scaling. The first one after the scalings is the other one that has So scapulae, this is the levator scapulae. So that's a little tip I give you so you can remember the order. You have here, again, sternocleidomastoid, the sternal head, clavicular head going towards the mastoid process of the temporal bone. After, posterior to the sternocleidomastoid, you have the scalings, anterior, middle, and posterior scaling. Then you have the scapulae, so levator scapulae, right here the splenius capitis. And let me see if I can show you, there is a difference in the fibers. You see, these fibers are the scapulae, and this one is the splenius capitis. And afterwards, all the way in the back, you have the trapezius.